So first, I'm going to say first thing I want to do is welcome you, Eileen.
Thank you.
And I did not give you a lot of background, so maybe if you could provide a little bit more about your background and quite frankly, why you chose a consulting career focused on medical device quality systems.
Okay, well, like many people who just leave college, I got a lab bench job and grinded through that for a couple of years and finally realized, I want to do something a little more substantive. So I moved into manufacturing and proceeded into quality from there and worked along the way with many small sized companies up to big sized companies. So I've done while I was a real employee, I've done about 3 startups and also worked at Beckman Coulter and directed quality. It was about a $1.3 billion business, Diagnostics, obviously. So most of my career has been in IVD. About 11 years ago, I decided to become a consultant and in addition to doing IVD, I've been doing lots of different types of medical device, which I find fascinating, super challenging. It seems like a boring subject, but honestly, when you get into it, everybody's got their own set of challenges, their own business model they're trying to work quality system into. So it's always a challenge and way fun.
Great. Thanks a lot, Eileen. So I think there are people in the audience who have all heard the words quality management system,
right?
But they really don't understand what that means. So can you describe what a quality system is?
So a quality system is, we take our lead from the FDA, and so they've got a set of regulations which we are required to follow. And these regulations make complete business sense. They help us develop products that are safe and effective. They help us produce products that can be reliably and consistently produced over and over. And that also provides a way to manage your data so you can see how your products are doing. So it's really a whole system approach for how to run your business.
Okay, maybe we'll get into that in a little bit more detail.
Okay.
So what, other than the FDA reasons for why medical devices companies develop a quality management system, can you really talk about the business needs and the real benefit for a medical device company to establish a comprehensive and effective quality management system?
So the essence of a quality management system is management. And we have the FDA. So the FDA has a set of regulations and they are telling us what to do, what you need to do to run your business. And the interesting thing about the FDA regulations and a quality management system, it's not about what the FDA tells us to do. They tell us, here's what you need to do, but we describe ourselves how to do that. And so it's a very, not a prescriptive way to do it. It's a very, okay, here's what you need to do. We each decide for each company how we're going to implement that quality management system so that we can develop products that meet user needs and we can manufacture it as the specifications require.
Okay, I'm going to probe that a little bit more in the next couple of questions.
Yep.
So if I'm starting a medical device company, perhaps some of the people in this webinar are actually either starting a company or thinking about starting a company, when's the best time to actually plan my quality management system and actually implement it?
Right up front. And the reason that's so important is we need to understand, well, first of all, we need to understand where we want to take the business. So if you're going to do a 510K, if you're doing an EUA, we need to have a solid business plan. Once we've got that solid business plan, it is absolutely key to understand, okay, how am I going to partner with quality? Who am I going to hire? How am I going to get that quality management system executed based on what that business plan needs? So I would say it's absolutely critical that you have a expert at managing a quality management system that can link up with the business plan and understand what's the order of go for what systems need to be in place when. So in my mind, the first thing is making sure you've got someone to assist you that understands how to implement a quality management system, and then come up with a plan of how to do it logically, slowly, not in a burdensome way, get through it all. Because it's really not that difficult, but it needs to be approached with a plan.
Okay, so you've mentioned the FDA has a series of regulations or series of guides. So I think of those as the elements of a quality management system. So maybe for the audience, we'll probably need to spend a little bit more time on this. Can you kind of describe what the key elements of a quality management system are?
Right.
And why, what they are and why they're needed? All
right. So of course, Richard's going to expect me to say management controls has got to be number one. And I agree with that. You got to have management that understands how to manage the quality system. And it's super critical that that management understands details like, oh, how are we going to do process validation? Well, what do you mean user needs? And that means design validation. How does that whole thing fit together? Super critical that management understands their quality system. So that's management controls. There's a whole lot more to it. I don't know how much detail you want me to go into it, but management is responsible for providing the resources for the quality management system. So how can you provide resources unless you understand what's going on in that quality management system? They're responsible for making sure that people are trained, all kinds of things, internal audit, management review, making sure you're reviewing your quality management system periodically so that you can make changes and say, well, no, this is not, we cannot go that way. We need more people, or else we're going to have to change our process or the like. So management, finger on the pulse constantly with the quality management system, absolutely key. Some of the other sub-elements are purchasing controls. Obviously, managing your suppliers, super critical for the business. Production and process controls, how you manufacture your product, whether you're going to have an OEM do it or you're going to make it in-house. How do you do statistical process control? All that things. How do you monitor your environment? How you do process validations and manage that whole production facility. That's all around this huge thing called production and process controls. Calibrating equipment. It's a big one. Production and process controls is super important. We have CAPA, which everybody knows, corrective and preventive action, I'm sure. How do I solve my big systemic issues? Super critical. All the way down to records, which includes things like your design history file, which I should say skipped right past design controls, sorry. Design controls, another important aspect, and that's all about how do I define my user needs, what does my customer want, and product requirements all the way down to what's the design input, what's the output, and how are we going to make sure that what we've designed is going to work for the customer.
Actually lost you.
Lost me? Nope.
Eileen froze.
I can hear you.
Okay, we got you back.
All right. Design controls, very important. And at the end of the day, you get a design history file and a device master record, which is the quote recipe for how we're going to make this product. All super important. And then complaint system, obviously critical, especially from an FDA point of view. As you're managing your complaints, they have full view into if you have a complaint that's caused a serious injury or has potential to cause a serious injury, they could get involved. So complaints, how you solve your problems, super important. Those are the big ones. Let's see if I got them all.
All right, so maybe we'll take a step back. We're going to go into these perhaps one at a time.
All right.
And I'm working with a lot of startups. I'm actually working with a lot of startups right now in the COVID space. And a lot of startups really don't understand the difference between a user need and a product requirement. And maybe if you can spend a few minutes about what the difference is between a user need and product requirement and how the FDA looks at those, because they actually look at them differently. And I kind of want to tie it to two other words, verification and validation.
So a user need or a customer requirement, you can call them either, is what the customer would say to you. I want a simple, reliable device. A product requirement is the translation of how that gets turned into, so what am I going to do? Reliable means X, or simple means only 3 steps, or simple means 2 steps, whatever it is for your product space. So the important thing to remember is that a user need, or what the customer wants, gets validated. So that is called design validation. So you write tests that make sure that you have designed what the customer wants. And the way I look at it is quite simply all the in-between stuff, how I'm going to do it, you know, what size is my, I don't know, LED or whatever, all of that in-between stuff is what you verify. But the main user needs is design validation, all the in-between requirements, how you make that happen at your company, all gets called input, and then finally output, and all that gets design verification. Is that oversimplified?
I don't know. We'll have to see what the audience thinks as to what it is, because again, I see a lot of people, and again, I'm working with a lot of companies right now. They really don't understand those two things. They confuse the two. And of course, when you read FDA language, it's also, the FDA is not
straightforward.
Right. So I think you explained it pretty well. You know, one of my favorite parts of the quality management system, again, back from my R&D days, is design control. And again, maybe to help the audience, and where I see a lot of companies really fall short, and I did earlier in my career, is not having adequate design control. Can you kind of describe it and maybe help people understand what does that actually mean and why it's so important?
So the FDA regs are pretty straightforward. And the first thing that they start with is a plan. So you need a design and development plan. And there's some requirements in that plan. Everybody's written a plan, but there's some key focus parts on that is, when are you going to do design reviews? And a design review is a review of a particular phase of your design process, or we'll just leave it at that. It could be a review of your customer needs, but there are a few required design reviews. So you outline those in your plan. And the way I like to look at the user needs, in my oversimplified version, the user needs are really helpful to think about it in a linear process. So every user need gets a requirement or some sort of input, and you follow it all the way across the whole cycle, all the way to design validation. So the same thing with all the inputs and outputs. If you think of it in a linear way, which is very much the way the FDA thinks of things. So when they come in, they really like to see what I call a trace matrix. So it's lining up your user needs. Here's my product requirements. Here's all my inputs. Here's my outputs. Here's how I'm going to verify all my outputs. And here's how I'm going to validate my user needs. So the FDA really likes to see that, this sort of a trace matrix, and how you accomplish that, you could accomplish it kind of any way you want. But they really like to see that trace matrix, that linear flow. Oh, so we have a problem over here. Can I flow that all the way back to my user need? Where, you know, what's the whole design process?
Maybe just working, because I don't know, again, the experience of the audience here,
Ah.
is the FDA uses two words. We use two words all the time, and maybe, again, I think it's evident maybe to you and I, but it might not be, you and me, it might be evident to everybody else. Is the FDA is worried about two elements. Is your product safe? And is your product effective?
Right.
So maybe you could, again, relate back to design control and design inputs and verification validation. Can you maybe help the audience understand what those words mean?
So safe means that, of course, you're not going to cause injury or harm anyone. And effective means that your product is doing what your intended use has said it's going to do. So of course, with this design control topic, woven all through that is risk management. So it's pretty critical that you figure out early on how you are going to manage risk management. So for example, risk management is not only within the design control space. We should think about from a complaint point of view. When I get a complaint about my product, have I identified that as a potential harm? And now what are we going to do? Or have I tried to eliminate all these risks that I've pre-identified that my product could possibly do? And of course, we try to mitigate all the risks, but we know that sometimes things slip out. So we want to prevent things from slipping out and have a robust risk management process so that we identify any of these things that could cause an unsafe product being on the market.
Great, thanks. So here I am, I'm a startup company. I have three people, two people is me and my buddy. We're getting this company. We think we have I'm trying to think of a good example. Oh, no, I'm going to come out with a brand new test for detecting COVID-19 in 3 minutes or less that everybody in the world's going to want to use. I guess I had this great idea. It's something brand new, never been done before. I got to set up a quality management system. Where do I begin? How do I start it?
So I'm going to go back to one of my other statements, and that's you've got to get somebody that knows what they're doing, or at least get counsel from somebody that knows what they're doing. And in my mind, I would start with a document control system, because remember the adage at the FDA is if you don't document it, it didn't happen. So you've got to figure out, how am I going to manage all my records, files, procedures, part numbers, bill of materials, whatever it takes to get your business going. You've got to start with document control and set it up. It can be simple. It does not have to be difficult, obviously, with 3 people. I'm working with a startup right now that's got 3 people. They're managing just fine with Google Docs and whatnot. But document control, it's got to start with document control and somebody that knows what they're doing, who can help you along the way, so you don't do anything catastrophic and have to go back and redo it. I would bolt on the other systems as they're needed. For example, I would start with document control. Obviously, if a startup company, you've got a design of something going on. So the second thing I would tackle would be design control and get that going. I would do it something simple. I wouldn't put any, with 3 people in the company, I would not do anything too arduous. Keep it simple, but stick with the basic elements of what's required by the FDA.
Great. I'm sure some people might have some follow-up questions on that, so hopefully they can ask that. So I'm now a startup company. I put some of those elements in. How do I know it's working? How do I know my quality management? So again, where I'm coming from is I've seen companies, they say they have a QMS or quality management system, but when I ask them, how do you know it's working? They kind of look at me like deer in a head. So how should a company do that?
Yes. well, number one, management review. So remember I was talking about management controls, and what's required is of that management is to hold management review. And that's usually done by a second, is probably number 2 person in your 3-person company. And they sit there and they have, you know, developed some sort of measuring system, something simple, metrics, that will measure the efficiency of all my processes and track what's going on. That should be reviewed by management on a periodic basis. So management review would be number 1. And hopefully management is involved in trying to figure out what the metrics are that they want to review every quarter or whatever. And in a small startup, that's actually more frequent reviews is probably better, right? Because you can hop on it quicker than waiting for 3 months. Second thing is internal audit. You know, hire somebody to do an internal audit for you. Always beneficial, a different set of eyes, somebody not affiliated with the company, always a good mechanism. It's those 2 items.
Okay, so I have a related question from L. Carol Holt. So I'm just going to read what was written. I consult with a startup company running clinical trials that started 6 years ago. Their view is it is too early to have a certified QMS. They've done no internal audits. Too soon. What is the recommendation of how to provide evidence to support the need for FDA certification prior to FDA submission of a 510K? Or is it acceptable not to have the certified or QMS certification? I think that's how I read it.
Okay. Well, first of all, we don't get certified by FDA. We get inspected occasionally. We list our products and we list our establishment registration, depending on what we're doing. Are we developing specs or are we a manufacturer or whatever? So we don't get certified. If we're getting, boy, 6 years is a long time. If we're, so I would question, no, how are they doing document control? Clinical trials, a lot of documents there. If you're getting ready to file a 510K, I would say it's really good to start thinking about how am I going to get complaints going into my system. I don't know what this company's doing from a production point of view, but I would, you don't get necessarily inspected right after a 510K submission, but it starts the clock ticking. And I don't know how long they're going to take to actually launch their product, but by product launch, you better darn well have your act together or you're asking for trouble in many regards.
So that feeds right into the next question. So I'm again a startup company.
Yeah.
I've never been inspected by the FDA. The 3 letters scare me. So maybe you can describe, and I think you've been the experience of many inspections. So what does the FDA look at when they inspect a startup for the first time?
So they walk in and they are going to look at your procedures, but guess what? It's not all about the procedures. It's about evidence that you actually implemented the procedures. Writing a procedure, anybody can write a procedure. I mean, it's like 20% of the job is the way I look at it. 80% is implementing those procedures because you've got to be able to show, I said I'm going to do this, and here's my evidence that I did that. Sounds super simple, but companies get tripped up not getting the evidence that they actually, or their evidence is non-compliant. I didn't follow my procedure. So it's that implementation is super key. So they will look at all these records that are the result of your implementing of your quality system. And they have the right to look at a lot of records, and they have a couple things they can't look at, like your management review and your supplier audits. But other than that, they can take a look under the covers at all of your records that show you've implemented your quality management system. And plus that, they'll take a look at your procedures also to make sure that you have complied with the requirements. But it's all about implementation and those records.
Yeah. And again, in your experience, I don't know if you've had that experience. What happens if they see a significant issue, like they don't have a QMS, they didn't implement their QMS, they don't have adequate records? What are the possible implications of that?
So the first order of business is they'll write you what's called a 483 observation, which is essentially a finding from their inspection of your facility. And you get the opportunity to respond within a certain amount of time. I think it's 15 days with, here's what I'm going to do about it. I'm opening up a CAPA. I'm going to do root cause and share your plan. And you will share your plan with them until they're happy that you're done and you've solved your issue. And usually it's multiple issues. Usually you have multiple 483s. After that, if they're not happy with your plan, you could get a warning letter. And I've done extensive work with companies who've gotten warning letters, and it's a very bad thing. So it's expensive. I mean, not a good thing. You're bringing in consultants usually to fix your problem, because obviously the people that you've got can't cope with getting the product out the door and remediating all of this things that the FDA is not happy that you've done. And then, all kinds of things like consent decrees. Fines, I mean, civil penalties, all not good. So it's really beneficial to write a good procedure and implement it correctly.
Okay, great. Another question from Carol. Please further describe, again, it's a good question. You have to list your products with the FDA and you have to establish an establishment license.
Right.
So can you describe those?
Oh, the FDA website, there is a lot of information. If you go on the CDRH website, and if you just Google establishment registration, they will take you right to it. It's simple, easy to do. I can't remember what the fees are this year. They went up a little bit, but there's a fee associated with that establishment registration right on the FDA website. Same thing with device listing. Whole host of information on that FDA website regarding device listing. You can look it up by product, and they even have people who will help you, actually quite reasonable people if you have a question. Really good website.
Yep.
And a plug for the CDRH Learn website too. That website for CDRH Learn, I'm telling you, I have recommended so many people of my startups go look at that. They have a great presentation. You can either listen to a live person, or not live person, but a video, or just get the slides on design control, complaints. And I think there's actually how to register your establishment and do the device listing. I think there's also information on that CDRH Learn website. It's awesome.
It is awesome. And I'm a direct believer of it. I've done it for a company, and if I could do it, yeah, I mean, it's relatively easy. It's a pretty simple website. All you need is fill it out, and you need to have a credit card.
Yeah, exactly.
Because you're not registered to actually pay for it. And by the way, you have to pay you have to pay an annual fee, depending on what kind of products you have. Now, of course, as soon as you're registered your products, and as soon as you have an establishment license, the FDA now has your name and address, and they can come knocking on your door at any time.
The clock starts ticking.
So just a couple more questions and we'll open it up for everybody else. What are the pitfalls for startups in establishing a QMS, and what should they avoid?
So my first thing is making the QMS too complex. The QMS should be designed so that it fits your business and the associated risk. Obviously, if you have a super risky business, your system's going to be a little bit more complex. From my warning letter remediation activities, my sense is they've started a QMS that's too hard to keep compliant to. Takes too many people, too much paperwork, overly complex. My second thing is failure to hire the right people at the right time. Super key, as I've been saying all along. And then the third thing is, I'm going to stress this, haven't focused on implementation. Got the procedures in place, let them sit there gathering dust, didn't implement. So those three things are my top pitfalls.
Okay. And then similar to that, but maybe if you can, without naming companies.
Yeah.
Again, you've worked with a lot of companies. You and I have worked together. You left probably right before we got into serious trouble with the FDA. But can you share some of the most common quality management systems you've observed, again, without naming anybody?
Well, the ones that get bubbled to the top and stay in my mind are those situations where I've had to step in and do a warning letter remediation. And you look back at those, and those usually start from not providing a safe and effective product to the people. So that it's had some egregious serious injury or potential for a serious injury. And so when you start to look at it, they put in CAPA processes that don't find problems, that aren't measuring things. They're not being run effectively, not getting to root cause, not following up on, oh, does that have to change the product to make it better? But then I need to do a process change. Do I need to validate it again? All those things, when you start getting into that warning letter CAPA situation, are seems to me, from my experience, from doing the warning letter remediation, where the most issues occur. And of course, once the FDA starts rooting around in your complaints, that opens up the whole inspection on complaints and what's really going on in your complaint system. And I don't know, they tend to find a lot of things wrong with your complaint and CAPA system. Yep.
Okay. Great. Yeah, I actually had a recent challenge with a company. I just want to put this aside. It really wasn't have to do with the FDA. It actually it's a non-FDA related issue that they had not implemented a quality management system. So they were actually getting ready to submit their 510K, and they were ready to do their clinical trial. And it turned out the product that they were making right before they went into clinical trials stopped performing. It no longer was working as they had thought it was going to work. And as they investigated it, not in a quality management system, because they really didn't have an effective quality management system, they actually found out that some of the parts they had purchased and put into the product without testing them first were defective. So maybe you can talk about that. I mean, the experience that this company had is their schedule, because now it doesn't work, got impacted by months. And if you're a startup company and you're using investor money, they quickly are realizing that they're actually at the risk of going out of business because they don't have any more money to actually fix the problem.
Right.
So to me, quality management systems more than just the FDA. It's actually, you said this at the very beginning, and maybe if you can emphasize it with some other examples, it's simply good business.
Yeah.
It has nothing, even if the FDA wasn't here, it's something you should have anyway.
Yeah.
So I don't know if you want to comment on that, or I just made the point.
Well, I mean, the thing is, I think, if we just start with design control, I mean, how else could you manage your product unless you did design control? It totally makes sense from A to Z. And I'm going back to your example. Okay, so they probably had some problem with their non-conformance process, or maybe they didn't have a non-conformance process, or maybe it was something to do with purchasing controls. A supplier produced something and they didn't have things set up right, was who's like responsibilities, who's checking what, I don't know. But just managing all that stuff, it just makes so much more sense. As a manufacturer, you are in charge, you have to manage it, or you're gonna be into trouble.
So I'm just gonna, maybe we touched on a lot of things. I want to give the audience some time to ask some more questions. Again, thanks, Eileen, for all of your insight. Do you have any final guidance for the audience before we move into the Q&A?
Keep it simple. That's my mantra. Keep your quality system simple and commensurate with the risk associated with your product.
Okay, thanks a lot, Eileen. So with that, please, anybody in the audience, ask questions. We have an expert here. I know it's a foreign subject for many companies. Again, I'm working with many startup companies. The two most common mistakes I see companies make, three actually, is right away they have an idea and they run to the lab, like in the ULP. And they, as Eileen said, they have not established a QMS. They haven't thought about it. And the second one, which is related to the QMS, they actually haven't spoken with customers to actually find out what customers really want and will they actually buy their product. So with that as a backdrop, I'm just going to see if anybody in the audience has any Q&A or questions. We'll do the answering. Feel free. Raise your hand if you want.
Chat box. I'll just read it out loud. It says, hi, I'm a one-person startup company for a class 1 501k exempt device. What are the FDA QMS minimal needs? I am aware of complaint processing, validation testing, medical device service record. Anything I am missing? Do you have any recommendations for how to go about this as a one-person company with limited funds, manufacturing order placed this month and expecting sales next month?
So first of all, the regulation's pretty specific, but first I'd have to ask the question, do they have software, automated software in this medical device? If they don't, the only thing they need to do is complaints, they've got that right, and records. So they need to maintain DMR and DHR manufacturing records. So pretty simple. They don't need to design control if there's no automated software for a class 1 device. In the regs, they've got a list of ones that are included in where they need design control. I don't know them off the top of my head, but.
The only thing that I would add is there's, again, the FDA QMS minimal needs, but there's also your business needs. So if you're a one-person company and you decide to actually sell the business, and you actually don't have really good documentation in place, you just might run into more difficulty trying to actually exit the business and sell the business. Because just like in the FDA, if you don't write it down and document it, it doesn't exist. It's also true in the business side. If you don't actually document it and write it down, it doesn't exist. So a lot of again, you should look at the elements of a QMS and you should decide what you need from a statutory viewpoint, from a legal viewpoint. But I think just as importantly, you should think about what you need to actually run an effective business and to grow the business. But thank you. We do have another question. How do you start as a full-time consultant in this industry? Oh, good luck with that. Let's see.
Yeah, I don't know how to answer that. I mean, I got kind of fed up with working hugely 70-hour weeks and somebody telling me that I was going to work 70-hour weeks. So then I turned it into, well, okay, I'll work 70-hour weeks, but I'll do it on my own time. Yeah, it takes a lot to be a consultant because it's huge risk, right? No benefits and no vacation, no sick pay, no health benefits, but you have to be passionate about what you're doing to be able to do it.
Yeah, I'll add to that. So I know a lot of people that say they want to be a consultant, but it's actually really hard work. Moving from getting a regular paycheck to being a consultant for the first 6 months, you might not make any money. So one thing I do suggest, because I talk to a lot of people that want to be consultants, I say, you might want to keep your job, whatever you have, and save up lots of money so that you can actually survive for a while. And then it's funny, it's much harder in a pandemic world. I actually started by networking. I went out and just talked to people in person, and then through Zoom calls, just making connections. But probably Eileen can speak for herself. I've been working for 30 years. We just knew a lot of people. So people actually find us as opposed to us finding them, which is what I found out with my consulting business. But it's not for everybody. But I agree with Eileen. I should have started consulting years before I did.
I agree.
I would probably have been a much happier as opposed to working 70, 80, 90-hour weeks.
Well, and the thing to remember is people don't pay you necessarily every 2 weeks. Some people pay every 8 weeks, and try as you might to get your invoices paid in 30 days, you're still working about 45 without getting a paycheck. So I know people who've had to actually take out home equity loans to become consultants, which seems a bit extreme. But at the end of the day, I think we have fun. We try to have fun with what we do.
For sure. Okay, any other questions? Don't be shy. There's no bad questions.
I think there was one straggling question. Someone was asking, is there a location that they can receive like templates or resources as a starting place for the QMS?
I don't know. Do you have an answer to that, Richard?
No, I'm not. I'm not aware of anyone that actually has templates. There are some companies out there that, and they're web-based companies that are now selling electronic QMSs as a service. I want to say Evergreen. I don't know if that's the real name of the company. But there are a couple products out there that you can actually essentially subscribe to and allow you to establish a QMS. And I've heard of companies using it. They seem to like it. But again, I don't have any experience of it myself.
Right. I think it's called Greenlight Guru.
Okay, maybe it's Greenlight.
Yeah.
So you can check with Greenlight Guru. Again,
It's not free.
Yeah.
Nothing's free.
It's definitely not free. Maybe they have a 30-day free trial. You can see what it is, but I also don't know how expensive it is. I have no idea. Okay, another question is, what is the optimal way to improve your company's OQ, IQ, and PQ process? So now you're gonna have to explain OQ, IQ, and PQ, and then, which is a great question. And what are the common issues you've seen in your experience with process controls? Great question, Khalid.
Oh, tough one. Let's see. Well, IQ, OQ, PQ is all around process validation. And so IQ is installation of whatever machine, equipment, instrument you're installing. So do I have the right power, and do I have the right floor space or lab space or whatnot? Simple. IQ, OQ is operating. Does it work? Does it do what the whoever's selling that piece of equipment to you, does it actually do what they say? Maintain like maybe it's a water bath, something simple. Does it maintain the temperature to within the range that they say? And then the performance is, does it do what you as a company need that water bath? That's a silly example. That's the only one that came to my brain quickly. Does that water bath do what I need it to do in my case? So that's IQ. How could you improve? Gosh, that's a tough. So I explained what it is, but I don't know. I don't know what's wrong with your process. I'd have to look into that. I don't think there's an easy answer. I don't know. Am I not thinking about this right, Richard?
I don't know either. The common issues that I've seen with process controls are people don't do them.
Right. Just failure to do
just,
it.
just failure to do it, or they don't think about all the processes that they have and all the equipment they have. They think of like a big piece of equipment, a special piece of equipment, as opposed to a pH meter. And again, the number one issue I see in companies, and this is big companies and little companies, is simply a pH meter. They actually don't understand. They've never set up IQ, OQ, PQ on their pH meter. Turns out their pH meter doesn't work. And if your pH meter doesn't work, a lot of things in my biological world falls apart.